Today we're looking at something that seems to be popping up more and more in conversations about birth, the doula.
Right.
It feels like more people are considering this kind of support, during pregnancy, the birth itself, and even afterwards.
Yeah.
So what's going on there? What does a doula actually do?
That's a great place to start. Fundamentally, a doula is a trained professional providing non-medical support. Think emotional, physical, and also informational support for families expecting a baby or who have just had one.
Okay, non-medical, that's key.
Absolutely. And it's not just about the delivery day. You've got fertility doulas helping before conception, birth doulas for pregnancy and labor, and then postpartum doulas for those first few months. Some even cover that whole spectrum.
Wow, okay, so it's pretty broad. Our goal today, then, is to really get into what doulas do, how they're different from, say, a midwife or an OBGYN, what the actual benefits are, how the whole process works if you hire one, what the costs might look like, and how you'd even find the right person. Basically, helping you figure out if a doula fits into your ideal birth experience.
Exactly. So let's dive into their main role, especially during labor. What are they doing? Well, at its core, it's about providing continuous comfort, encouragement, just steady emotional and physical support.
A consistent presence.
Yes, that's a great way to put it. Someone who is there just for you the whole time.
That sounds amazing in such an intense time. But you stressed non-medical. It's really important to understand that boundary, isn't it? They aren't doctors or midwives.
Precisely. They're not making medical decisions or performing clinical tasks. Think of them more as a knowledgeable guide, maybe a soothing voice of experience, helping with relaxation, breathing, suggesting positions that might feel better or help labor along.
That hands-on, non-clinical support. And does that start before labor kicks off?
Oh, definitely. You'll usually meet your doula a few times beforehand. It's crucial for building that relationship so they understand what you need, what you're hoping for, maybe what you're worried about.
Right, so they know you.
Yes. And they can be a great resource too, maybe suggesting a good chiropractor or acupuncturist if that's something you're looking for. They often cover some basic childbirth education too, helping you feel more prepared.
So they're part support, part resource connector. Okay, when things get intense during labor, what kind of non-medical pain management tools might they use?
They have quite a toolkit. It could be massage, maybe some reflexology, using aromatherapy with certain scents, or even just helping set a calming mood with music or affirmations like mantras. It's all about finding what works for you.
That personalized comfort. And another piece that sounds really vital is advocacy, helping make sure your preferences are heard.
Absolutely key. Labor and delivery can be overwhelming environments. A doula is there to help you articulate your wishes, to make sure your voice is heard by the medical team. They're championing your birth plan.
Okay, what about partners? If someone has a supportive partner or coach, does the doula replace them?
Not at all. A good doula actually enhances the partner's role. They can give the partner suggestions, help them feel more confident in how to support the birthing person. It's really about supporting the whole team.
That makes sense. It's collaborative.
Yeah.
Now, let's clear up something I know trips people up. Doulas versus midwives. They sound similar, but they're quite different.
Very different roles, yes. It's a common point of confusion. Midwives, especially certified nurse midwives, CNMs or certified midwives, CMs are actual healthcare providers with medical training.
Okay, medical training.
Right. CNMs are nurses first, then they do graduate level midwifery training.
Yep.
They're licensed, certified. CMs also have graduate midwifery education, but maybe not the nursing background, and their licensing varies by state. For the patient, this often means CNMs might offer a wider range of services or practice in more settings.
So midwives are qualified to provide medical care during pregnancy and birth.
Yes, for low-risk pregnancies. They conduct exams, order tests, interpret results, prescribe certain medications, manage labor, deliver babies in uncomplicated births, and even do routine GYN care.
That's a huge contrast to doulas. What's the typical training for a doula look like?
It's quite different. There's no graduate medical degree required. Many doulas do get certified through organizations like Doula International, for instance, but it's not always legally mandated. That certification training, say through Doula, Involves maybe 16 or more hours focused on practical comfort measures, the physiology of birth, the benefits of support,
Yeah.
really honing those non-medical skills.
So the training is all geared towards that emotional and physical support role.
Exactly. Doulas don't perform medical procedures. They absolutely cannot deliver a baby. They don't prescribe anything. Their focus is entirely non-medical, which frees them up to provide that continuous emotional and physical support we talked about.
You can have both, right? An OB or midwife for the medical side and a doula for the support side.
Absolutely. Many people find that combination ideal. They work together, each fulfilling a different vital role.
Okay, that distinction is much clearer now. So let's circle back to the why. What are the concrete benefits people report from having a doula?
Well, one big one is that continuous care. Your doctor or midwife might change shifts. They have other patients. Your doula stays with you, start to finish. And that often includes visits before and after the birth, too, maybe helping with early breastfeeding.
That consistency must feel really grounding. What else? Are there measurable positive outcomes?
Yeah, research suggests some really interesting things. Doula support has been linked to potentially shorter labors, lower reported anxiety levels for both the birthing person and their partner, and even a lower chance of needing interventions like C-sections.
Really? Lower C-section rates?
That's what some studies indicate. And there's also evidence pointing towards better parent-baby bonding afterwards, perhaps because the doula helps create a calmer, more focused environment.
Those are pretty significant potential upsides. And breastfeeding, you mentioned that.
Many doulas have lactation training. Having that support right from the beginning seems to improve the odds of breastfeeding success. They offer practical help and encouragement when it can feel really tough.
And I imagine for someone maybe without a partner present or without strong family support nearby, a doula could be incredibly important.
Absolutely. They provide that dedicated, focused support that can make a huge difference, especially in those situations.
Okay, so if someone's listening and thinking, this sounds really good, what's the actual process? How does it work? When should you even start looking?
Good question. Ideally, you'd start looking maybe around the 7th month of pregnancy. That gives you time to interview people, find someone you click with, and make sure they're available around your due date. But honestly, it's never truly too late to look.
7th month is a good target, though. And what happens once you've hired someone? What are those prenatal meetings like?
It's all about communication. You'll talk through your birth plan, your wishes for labor, pain management preferences, whether you want medication or not, specific comfort techniques you like. They really want to understand your vision.
And then when labor starts, how do they jump in with pain management and support?
Well, they bring all those non-medical techniques we discussed, massage, positioning, creating that calm space. They offer constant reassurance. And sometimes, if your doctor or midwife approves, they can even support you at home during early labor before you head to the hospital or birth center.
It really sounds like teamwork in the delivery room. How do doulas usually mesh with the doctors and nurses? Is there ever tension?
Generally, it's a very collaborative relationship. Most medical professionals understand and respect the doula's role. They know the doula is focused on emotional and physical support, while the medical team handles the clinical care and safety. It's usually best practice to just let your doctor or midwife know early on that you plan to have a doula.
Open communication. Okay, so how does someone decide if this is actually the right choice for them? What should they consider?
Ask yourself, do I feel like I'd benefit from having continuous one-on-one coaching and support during labor? Do I have strong preferences about my birth experience and want someone purely dedicated to advocating for those? Remember, doulas support all kinds of births, medicated, unmedicated C-sections. It's not just for one type of birth.
Right.
Also consider if you want support beyond what your partner or the hospital staff might be able to offer consistently. And sometimes, if there are limits on hospital guests, a doula is often considered essential support, not just a visitor.
Good point. Okay, the practical side, money. What does hiring a doula typically cost?
It does vary quite a bit. Depends on where you live, the doula's experience, what's included in their package, like how many visits before and after. But a general ballpark for birth doula services might be somewhere between, say, $800 and $2,500.
That's a range.
Yeah, and postpartum support might be hourly, while birth support is often a flat fee package.
Are there ways to make that more manageable? Insurance, maybe?
It's definitely worth looking into. It's changing, but some private insurance plans are starting to cover doula services, at least partially, and in some states, Medicaid is covering it or considering it. Also, check employer benefits. Some companies offer wellness funds or specific parental support benefits that could apply.
So step one is call your insurance company.
Absolutely. Ask specifically about labor support, childbirth education, lactation support. See what the policy says, and check if you can use HSA or FSA funds. That's often possible.
Okay, great tip. So someone's decided they want to find a doula. Where do they start looking and when?
We mentioned starting the search early, maybe aiming to hire someone by week 20 if possible, just to have plenty of time. Word of mouth is huge. Ask your doctor, your midwife, friends, family members who've used the doula.
Personal recommendations are powerful. What next?
Interview a few candidates, at least 3 if you can. You need to see who you connect with. It's a very personal relationship, so you want someone you feel comfortable and safe with. Trust your intuition on this.
Makes sense. Are there reliable places online to search?
Yes, several good ones. Organizations like CAPA, Childbirth and Postpartum Professional Association, Donate International, Birthing from Within, they all have directories. DoulaMatch.net is a popular search site. Doula Trainings International, too.
Yeah.
If you're interested in hypnobirthing, the Hypnobabies site lists specialists. And importantly, the National Black Doulas Association, NBDA, is a vital resource for connecting Black families with Black doulas, addressing crucial health equity issues.
That's incredibly important to mention. Now, we focused a lot on birth doulas. Let's touch back on postpartum doulas. What's their specific focus?
Their focus shifts entirely to after the baby arrives. It's all about the well-being of the new parent and the baby in those early weeks and months. They help with the parent's physical and emotional recovery and offer practical help with baby care bathing, diapers, swaddling, understanding sleep cues, feeding support.
Like a guide for that transition period.
Exactly. And many are also certified lactation counselors, so they provide expert breastfeeding help. They offer advice, build confidence, and importantly, they can also help recognize signs of postpartum mood disorders, like depression or anxiety, and connect families to help if needed.
So if someone wants both birth and postpartum help, should they look for someone certified in both?
Yes, it's a good idea to ask potential birth doulas about their postpartum training and experience. Some specialize, others offer comprehensive support packages covering both phases. Definitely worth inquiring about.
So wrapping up, whether it's for birth, postpartum, or the whole journey, it really sounds like having this kind of trained, compassionate companion offers significant value.
I think that's fair to say. The personalized attention, the continuous presence, the evidence-based information, it can all contribute to a more positive, empowering experience for the whole family.
To sum it up then, doulas provide this really valuable layer of non-medical support. They don't replace doctors or partners, but they complement them, aiming for a better, more supported birth journey overall.
That's a perfect summary. They fill a really unique and increasingly valued niche in supporting families.
So thinking about everything we've discussed, the support, the advocacy, the continuity, what specific part of having a doula resonates most with how you imagine your own ideal birth experience? And what other questions pop up for you as you think about making this choice for your family? That's something to mull over as we finish this deep dive. Thanks for joining us.